So some of them can be that you might be someone who we might consider to be a case of borderline dry eye. So in a situation without contact lenses in, you don't really notice your eyes too much, and then a contact lens requires a bit more out of your tear film, and so you tip from being asymptomatic to symptomatic, and so that may be that we need to be managing a dry eye situation. For some people, it might be just as simple as using some lubricants with their contact lens to when they're getting symptomatic, but then if you're finding that you're not getting relief from the contact lens, I mean, we always sort of say with contact lens, where if in doubt, take them out if you've got sort of ongoing discomfort. It's easier to assume it's dry eye. You don't want it to be an early infection, but the main thing is if you're finding lubricating your eye with the lens in helps, then that's a fine way of sort of managing it. It can be just environmental reasons. A good part of dry eye symptoms in general, whether you're wearing contact lenses or not, is not blinking enough. And so when we're concentrating, so long drives, working on the computer, reading, doing anything that requires us to concentrate, we don't blink as often, and so therefore you're not re-wetting the front surface of the eye or the front surface of the contact lens. And we tend to do incomplete blinks as well. So part of that, we're not wanting to interrupt the flow of information in, we do these little half blinks where the bottom half of the eye and the lens dry out because we're not getting that complete sort of closure. So we do talk about, moments of mindful blinking, taking breaks to make sure that your eyelids are actually meeting. It doesn't need to be a squeeze, just needs to be that the eyelids touch. So that can be one way of managing it. Other forms of irritation with contact lenses can be from protein buildup. So, and we have proteins in our tears, and they can bind and stick to the front of the contact lens, and different lens materials and different people might deposit it at different rates, and that builds up over time. So if you're wearing a lens that is a reusable lens, so if you've got a soft lens in as an example, that you might take it out every night, but you get to wear it 14 times or 30 times before you dispose of it, then you can get an accumulation of protein from day to day. And so that becomes very important to make sure you're rubbing that lens, because that can create irritation and discomfort. And if you put up with it for too long, you do get people who build up an allergic reaction to their own proteins on the lens, and contact lens wear becomes a lot more difficult for them. One of the ways we get around that is using what we call single-use or daily lenses, because you're really disposing of them before that protein gets a chance to sort of build up on the lens. Yep. So we typically look at daily lenses having some of the lowest complication rates around. So our preference is, if, regardless of whether you're a part-time wearer or someone who wears lenses every day, daily lenses can be a really good choice if they're available in your prescription. To help manage that. And then you've got different materials. So some people find there are certain types of materials that they just don't find as comfortable. It could be the design of the lens itself. Does it have any sort of wettability coatings? It's the edge design. And so that becomes part of the art of fitting contact lenses, is knowing that you may need to simply just try a different brand or a different profile in order to get some improved comfort.
I have heard of extended wear contact lenses where you put them in and leave them in for days, or if not longer. Is that something that you still provide patients? And why would a patient go that route rather than putting something fresh in their eye every day?
Look, it can be seen as a bit of convenience. Most people learn how to take a lens in and out. They might not like the process, and so want to avoid having to sort of do that. There are generally some cases who just find contact lens handling a little bit more challenging, so leaving a lens in can be an advantage. I'm sure there's certain lifestyle choices where not having to take the lens out is sort of a benefit. The challenge we've got is that your risk of an eye infection is much greater with extended wear. So it was a big, probably, that when they brought the new generation materials out, it was touted as being this thing that was going to change extended wear, but the reality is it didn't really decrease those infections related to extended wear as much as I was sort of hoping. So we tend to track it very carefully, and everyone's different. You'll get some people who seem to manage it just fine, and others it becomes a much more risky thing. And you're dealing with infections. If you get a bacteria that kind of gets underneath the lens, some of them can permanently damage your sight. And thankfully they're quite rare, but the risk does multiply up if you're doing extended wear. So we don't tend to do it all that often now.